So let me set this up for you. This is Ryleisha. She is a 16-year-old female who just found out that she has HIV. You have a choice as a nurse. After you tell her the bad news, how are you going to handle it? The good way or the bad way?
Hey Ryleisha, how you doing? I'm Alyssa. I'll be taking care of you tonight. Do you have any questions about your recent diagnosis?
It's not my diagnosis.
Are you sure?
Yes, I'm sure.
The test came back positive.
The tests are stupid, just like you and just like the doctor. Everyone in this hospital is stupid.
Well, have you been sexually active?
I'm not telling you that.
Well, I mean, it's my job to know.
No, I've not been sexually active.
Well then, so you're a virgin.
I didn't say that.
Okay, are you a virgin?
Why are you asking me so many questions?
Because it's my job.
It's not your job. You're not a doctor.
It is my job.
No,
I'm a nurse.
you're stupid and you don't know anything. You need to get out of my room right now.
No.
Get out of my room. Get out of my room. Get out of my room!
All right, now wait a minute. Don't let that little child talk to you like that. You're a nurse and she's questioning your education. She thinks that she knows it all, but she's obviously been sexually active or something. Go in there and get the questions.
Now, she is a child. She's a sweet, innocent child that doesn't understand.
She wants to throw things and act a fool in here. Why don't you go back there and show her how her parents should have treated her? She apparently didn't get any discipline in her life. That's probably why she's got HIV. You need to go back in that room and show her who's really boss.
But I mean, she is just a child. Maybe she's just scared. I think you should go back in there and try one more time and just comfort her. Let her ask you some questions. Let her voice how scared she is. Don't force her. Just be patient and kind and gentle with her. That's what makes you a nurse. Understanding and patient.
Thanks, good conscience.
All right, that's how you're going to be.
Hey Ryleisha, how you doing? You calm now? You've been calm? Mm-hmm. Look, I know that this is difficult. You're young. You don't think that anything should happen to you like this. Trust me. Everyone goes through these situations, and it is not the end of the world. It's not the end of your life. There are medications. There are treatments. You can live a long, healthy life as long as you are, taking your medications and living a healthy lifestyle. You can even go on to have children if you choose.
How do I tell my parents?
That's going to be hard. That's probably going to be the hardest thing. But with, if you want me to be in the room with you, I can help you and try to explain to them that this is not, the worst diagnosis. I mean, there are better ones, but this is not,
What if
you're not
they think
dying.
I was like sleeping around? I wasn't.
I believe you. I believe you. And they're going to be hurt for a little while. And they're going to have to, come to terms with it. But seeing you may help them be able to handle it themselves. And the doctor and I can be in the room. I can try to help take some of that pressure off of you so that you're not alone, because it is scary, and there are things that you're going to have to be able to learn and be able to deal with for the rest of your life.
Meet Hillary, a nurse who has just recently graduated from nursing school. She has just gotten a report on her patient who is going through severe alcohol withdrawals. The patient is beginning to become irate and angry. He has hit the call light 20 times in the past 5 minutes. Let's see how Hillary handles this situation.
Excuse me, nurse. I've been calling a nurse for the past 20 minutes. Where's my nurse?
Hey, Mr. Jones, what's going on?
It took you long enough.
I'm so sorry. I was busy. We were getting a report and doing shift exchange. I'm so sorry about that.
Do I look like I care? I'm in pain. I've been asking for pain medicine since the last girl came in here.
Well, listen, what's
Where's my
happening?
pain
I'm waiting on your doctor to give me back a prescription for your medication.
A prescription?
Yes.
I'm in pain.
What would you rate this pain as?
It doesn't matter what it is. I'm in pain and I want my pain medication right now.
I understand. I know you're in pain. Listen,
I think that you need to get out of my room and go get my pain medicine.
here, let's just take a sip of water.
If you get that water close to me,
Whoa. Are you going to let that drunk talk to you like that? I mean, come on. He doesn't know what he's talking about. You are, go in there, take charge, push him around, make him see that you know what you're doing.
Okay, put your knuckles down. You learned about withdrawal in school. He's going through a lot right now. I mean, you gotta think, he probably is in a lot of pain. He's all sweaty and gross. He probably hadn't been cleaned all night. He's really, really uncomfortable right now.
You're right. All right. Let's go give this a shot.
You got this. We believe in you.
Knock, knock. All right, we're going to try this again, okay? Listen, the doctor decided to fill that prescription.
Nice.
But before I get this to you, we got to set some ground rules, bro. We can't be throwing stuff. We can't be hitting. I'm very glad to take care of you. And it's actually, I love doing it, so just let me do my job.
All right, I gotta say, I'm happy you came back in here being proactive with the pain medicine. That makes me
I'm
real
sure you
happy.
are. And I also noticed, here you go, that you're kind of sweaty, and you've probably been out on the streets for the past couple of days, huh?
Yeah,
How about we get you a nice warm meal, and then we'll get you a bath, all right?
that would be really great. My scrotum is very sweaty.
I'm sure it probably is. So we'll take care of that sweaty scrotum, and we'll get you cleaned up. But this is a teamwork now, all right?
Thank you, ma'am. What's your name?
I'm Miss Hillary.
All right, great. I'm gonna request you every time I'm back here now. Nice.
Meet Riley, a newly graduated RN, and she is on her first shift with a psych patient who has been admitted for throwing candles at Bath and Body Works. Let's see how she handles this situation.
I think I just saw the devil and an angel. What is going on? What?
Miss Sanchez, hi. My name is Riley. I'm going to be your nurse tonight, okay? Can you tell me your name and date of birth? No? Okay, I'm just going to look at your bracelet real quick.
No! No, don't touch me! Don't touch me!
I'm just checking
People
your,
are trying to kill me!
I'm just checking
No!
your name.
No, please! Please, I'm so scared! I swear! I saw the devil walking around! I swear it! I swear I saw it!
Okay, let's just calm down a little bit, okay? I'm just going to look
I
at
need
your
to come!
bracelet.
I just want to go home! What are you people trying to do to me?
I just need to check your...
No! I need you to get out of here! Go!
She left scratch marks on me.
Whoa, whoa, whoa. Are you going to let that psych patient treat you that way? Like, she could have HIV or any STDs, anything else. Like, are you going to let her talk to you or treat you that way? Scratching your body?
Okay, I think that you are taking this a little bit too far, and you just gotta think. You're overthinking things if you start thinking about what diseases she could have, and you need to leave your bias at the door because this patient got admitted and probably hasn't had any of her medications, and we don't know what's really going on with her. And they tell us that whatever they see, whatever their hallucinations are, we're supposed to believe them. So you need to take it easy and go back in there.
But she already got her psych medicines. She got her medicines, and she's still acting this way. I mean, our body should be a temple, and she's abusing it.
Well, this patient is crying out for help, and this is what we do. We help the patient. And so you need to go in there, figure out a way to calm her down, and help her to not hurt herself, because clearly she tried to hurt you, and you're leaving her alone in there. There's no telling what she's doing by herself in there.
I mean, it's your life.
And it's your license.
You're right. You're right, Angel Nurse.
So take yourself back in there and take care of your patient.
Ugh, whatever.
There's something on the floor!
Hey.
There's something on the floor!
Hold my hand. Hold my hand.
There, do you see it? It's right there!
You, listen to me. You're in the hospital, okay?
No, it's right there!
You're seeing things, and they're not there, okay? Okay, they are not real. You're here with me. It's just you and me in here. Let's lay back. Let's lay back. Okay?
So I'm safe?
You're safe in here.
Okay.
You're safe.
You're not
This
gonna
is a safe place.
kill me.
No, ma'am. No one here is going to hurt you. We are all here to help you, okay? So I just want, we gave you a little bit of medicine that's going to help you, okay? It's going to try and get those hallucinations to go away. Okay, but if you act out and if you grab at people, they might put you in restraints,
I
okay?
don't want that.
We don't want that,
Okay.
okay? So let's work together so that does not happen. All right, I'll be here all night long.
Okay.
I'll be in your room.
Okay.
No one's gonna hurt you. No one's gonna harm you. Okay.
Okay.
But we gotta work together.
Okay. Woo.
Okay.
Thank you.
You're welcome.
We have Erica, a brand new nurse to the emergency department. Tonight, she's working third shift and she's about to get it handed to her. She has a 34-year-old male patient coming in after a street fight, being flirtatious, and Erica handling it like a champ as she is. Let's see how this all plays out.
Oh, wait a minute, stop. I need a stethoscope. Good evening, Mr. Ronald.
People call me Daddy.
Dang!
All right, my name is Jacqueline. I'm going to be your nurse for tonight. I hear you got into a
Oh,
street fight.
Jacqueline.
I hear you got injured today. What happened to you?
What happened to you? You fought from heaven, girl.
I'd like to do an exam on you if that's
Do an
possible.
exam. You want me to take my clothes off?
Well, I mean, I just gotta look you over.
I'll take my clothes off.
No, this isn't sexual. I just want to check you over to see where your injuries are.
It ain't sexual.
No, it's not sexual. But I'm gonna need to look underneath your jacket, okay? All right.
Come on in, baby.
For real, he's got the wrong girl. Why are you letting him talk to you that way and putting his hands all over you and pulling you to him on the bed? I mean, come on, really? You got to go back in there and show him who is boss. You are a strong, independent woman.
Whoa, ladies. Let's just take a second and let's really reflect on the situation. He is coming off the streets and it is cold tonight. And he was just trying to prove himself as a man on the streets. You know what I'm saying?
But seriously, you have to have manners. Like, I'm the devil and I still got some manners.
Agreed. Let's try a different approach. Maybe you allow a gentleman to go in there. Or you set boundaries the minute you go in. Keep a distance. Just keep your cool. You know what I'm saying?
I guess you're right, good nurse.
Hey, yo, Ronnie, let me tell you, dude. Listen, you know I got in that fight and I ain't dumb. But I got put in the ER and I got a fine nurse. Oh my gosh, she's so freaking hot, dude. Next time she come up in here, it is on. You best believe it. Yeah, dude, oh, she's here. Hold on.
All right. Ronald, I've come back.
Daddy, or
I'm not going to call you that. I'm going to call you Ronald because that's your name.
alright. Who are you?
I brought my staff nurse with me
Just helping her out.
just to help so that we have some extra eyes in here.
You don't want, like, privacy?
Not really. I don't need privacy because I'm going to treat you. And if you want me to treat you, you're going to behave yourself. Keep your hands to yourself and let me examine you so that we can figure out how to get you out of here,
Yeah,
okay?
he ain't no fun.
Well, you're not here having fun. You were in a street fight before you got here. The ER is not about fun, sir. Are you going to let me examine you and behave yourself?
What's gonna happen if I don't?
Well, then we're going to have to get security in here, and then they're going to have to restrain
You gonna call the cops?
Yeah, we're going to call the cops up in here. That's what I thought. Thank you, sir.
Yes, ma'am.
Hey guys, I know we kind of outplayed some of those scenarios, but some of these are really serious. And so we've decided to give you 5 kind of ideas and tricks to really kind of deflame some of these scenarios and really calm the situation. You think we're kind of playing, but we're really not. I know that from experience, we probably have experienced these in real life, and eventually you will too. So, Jackie, what would you do in your scenario?
5 steps you would take to dealing with a patient that's wanting to sexually harass you would be speak directly to the patient and have a witness there with you if you feel uncomfortable confronting them alone. But make sure that your witness is someone that's affiliated with the hospital, staff nurse or supervisor, security, someone like that. And make it known that in no uncertain terms that their behavior will not be tolerated. It's unwelcome and it's unacceptable. And if confronting the patient doesn't work, then report to your supervisor so that the offense can be documented with the hospital so that this patient will have something on their record so that future people dealing with this person know how to handle them. You can also transfer the patient to another area of the hospital or ask to transfer them to a different physician so that these nurses don't have to deal with them if they're specifically unruly. And always be careful to make sure that the patient is cared for so that patient abandonment issues do not arise. And prevention is key in keeping further occurrences from happening. Know the policies on sexual harassment and know your own rights. Every person has the right to feel safe in their workplace, but you must know that you cannot and that you can and cannot do things to protect yourself from people that are sexually harassing you and abusing you.
That's right. Okay, so 5 tips that I have for drug withdrawals, because they are a thing that you definitely will see, especially in our area. You'll see it on a daily basis, and there are things that you have to do in order to keep yourself safe and the patient. Number 1, when you go into the room, keep a calm, non-judgmental tone. Leave your bias at the door, like Miss Smith likes to say. It's very true. Number 2, watch for withdrawal signs and symptoms. You want to prepare in advance for like seizure activities. Keep suction by the bedside, and also keep oxygen there just in case. And they sweat a lot, so provide extra sheets, extra towels, anything to kind of just keep that at bay, and keep them clean. Number 3, limit the visitors, and if you ever have any suspicion of someone bringing in drugs, keep an eye out for them. I suggest having a sitter in the room at all times. No questions asked. You are there for their safety, and drugs are not safe. They don't belong in there. Get a sitter in there. 4, provide alternative pain management ideas for these patients that are calling every 10 minutes looking for pain medicine. Number 5, take any and all objects out of the room that may become dangerous for the patient or the staff members.
So, like she said about withdrawal patients, you're going to see a lot of them. You're also going to see a lot of mental health patients come through the hospital. When they get off of their medication, if they've been on a strict regimen for a long time, they can appear like disheveled and totally different than who they are in the outside world. You want to leave your bias at the door, like she said. If they are off of their medications and they do something wild out in public and get admitted, they will probably administer medications on arrival, but it still takes time for them to kick in. So when you go and talk to your patient for the first time and they're being verbally abusive or hallucinating or anything in that nature, you need to talk in a calm and collected manner. You need to reorient them to where they are. Do not ever talk about their hallucinations. Do not call them they. If she's hearing voices, don't say they, because that just validates that they really are seeing things. You need to let them know that you do not see, you do not hear anything, and that they're in the hospital and they're being treated. And you want to try and have the same nurses take care of them. You want to build a therapeutic relationship and a trustworthy relationship for them, because they are scared. They think what they're seeing and what they're hearing is real. So if they get physically abusive, then you might have to take a little more aggressive terms, but explaining to them what will happen and letting them know the consequences will hopefully keep that from happening in the long run.
For pediatric patients, it's very similar to some of the other things that have already been said. Consistent care, you want to develop that therapeutic relationship, because they're kids. They might want to act like adults, but they are kids and they're still growing and developing, and you really need to be able to talk to them in a way that they understand, and talking to them at their developmental level and paying attention to how old they are. Like if they're 16, don't talk to them like they're 5. Some things as a general hospital that can help with these violent situations. Develop an internal plan for what happens, like for your hospital. Make sure that you know what the plan is for your hospital. Establish criteria for terminating that care with the patient if they are behaving in a way that you cannot handle. Maybe someone else can handle the patient, a male during like a sexual assault situation, or someone who's had a little bit more experience, because as new nurses we don't always know how to handle these situations. And so with that, change of care plans with that, if you can't stop caring for that patient, move them into a room with less things that they can throw at you. Make sure you're watching them more closely. Make sure you're monitoring what is brought in and out of the hospital so that you know what's going on. Develop processes to restrict visitors and patient access to certain patients or all patients, so that they're not getting access to those things from outside sources. And then create training programs and require all the staff to go to these training programs, because if everyone's on the same page, then there is no question. Everything is in unison.
And just remember, it is your life, but it is also your license.
Daddy or out!